You said you used the calculator. You mean the impact calculator, right? The
Yes.
one on, and tell us how you use that and what that is.
So the impact calculator, I think I have to think back how we used it, but it basically says, you know, for the number of consults you're doing, it calculates how much cost savings. So it's a focus on cost savings versus the penetration rate is so volume-wise how much you're supposed to be doing. The impact calculator is a way to extrapolate. You know, because we don't cut people open, we don't make money. I mean, this is the thing that I've been hearing for 10 years, right? You don't make us any money. But the impact calculator is a way to show that you're right, we don't make money, but for every patient we see in the ICU, this is how much money we save if we discharge them earlier than they should have had we never seen them. So it's a little bit of an extrapolation, which is also very helpful. Mm-hmm.
Yeah, it's interesting that most of the nation's CFOs have been trained to only look at income, that is fee-for-service income and volume, and have not been trained to think about costs that are malleable, that can be modified. I think in many cases, hospital administration believe that those costs cannot be changed, that everything that is going on in the hospital is perfect and it all is absolutely necessary or it wouldn't be happening. It's a kind of naive faith in the medical profession. And when people really start to understand that the reason their EDs are stacked up to the rafters is because people are in the hospital whom no one has had a goals of care conversation with. So they're in the hospital day 17, day 27, because there's 6 consultants, but no one's stepping up to really take charge and say, what are we accomplishing here? And what's the goal here? That a lot of what's going on in the hospital doesn't need to be in the hospital. And if patients and families were asked, would prefer not to be in the hospital. So much of what goes on doesn't need to go on. And that much of what is going on is bankrupting not only our hospitals and our health systems, but our communities and our nation.